and I encourage everyone to get out there on the trails. So thanks so much, Philip. Back to you.
Great, Ellen. Thanks so much. A lot of activity coming up at TFN over the next couple of months, and we will welcome warm weather and get out of our condos and our houses and do some stuff. Now I'm really delighted to introduce today's speaker, Dr. Andrew Peregrine, who is the Associate Professor of Ontario Veterinary College at the University of Guelph. Andrew obtained his Doctor of Veterinary Medicine, or DVM as it's called, and PhD from the University of Glasgow, Scotland, before working for 9 years at the International Laboratory for Research on Animal Diseases in Nairobi, Kenya. Since 1997, Andrew has been an associate professor in clinical parasitology at the Ontario Veterinary College, and he teaches there, teaches DVM students who have registered in that program. In addition, he's a diplomate of the European Veterinary Parasitology College and the American College of Veterinary Microbiologists, with a specialty in veterinary parasitology. Andrew's research currently includes emerging parasitic infections of animals and people, as we will see with ticks, and drug resistance in parasites of dogs and sheep. Andrew, you ready to take it away?
Yeah, thanks. Let me just share my screen. Can you see that okay, Philip?
Yes, hold on. Yeah, I think so. That's great. Yeah.
That's great. Thanks, Philip. Thanks, Helen, Michelle, and everyone else for asking me to talk today. Please, Philip, Alan, or Michelle, if there are any technical issues, please feel free to interrupt.
Okay.
Philip, thanks very much for the introduction. Hi, everyone. Just to give you a little bit of perspective on this issue, as Philip mentioned, I worked in Kenya for 12 years before I came to Canada 27, 28 years ago. And I had a lot of exposure with ticks there. And when I arrived, I asked my predecessor, who was retiring at the time, what do you teach vet students about ticks? And the response I got was, you really don't need to talk about ticks because it's not an issue in Ontario. And I think essentially that was true at the time. Everything's changed since then. I very much got dragged into the issue because vets started phoning me up across Ontario and saying, do you know about this? What should we do about this? And so one of the things I wanted to cover today, a number of things. I wanted to make sure you're aware and comfortable knowing about the ticks that we find on ourselves and our pets in Ontario, and what bugs or pathogens they can transmit, particularly to us and also to our pets. By far the most important tick-borne disease, certainly in Canada and across most of the US, the most important one is Lyme disease. That's what all the concern is about. And so I particularly wanted to focus on what we know about the disease and how it's changing in Ontario. I particularly want you to appreciate how we think the risk of Lyme disease is going to change over the coming years. And things are changing very quickly at the moment. And one of the big drivers for that is wildlife in the environment. And that's a big driver for whether or not there's a risk of Lyme disease in certain areas. And I want to finish by just asking, going through a few issues that we can do whenever we're outside to reduce the risk of Lyme disease, both in ourselves and our pets. And then the other thing I want to do at the end is give you a little quiz. I teach vet students, and we always follow lectures with either a quiz or a final exam. So I'll give you a mini friendly one at the end. This is a picture taken in the ear of a dog in Guelph, where I am. It could easily be a tick, sorry, the ear of a dog in Toronto. And my question always is, when I show this image, is what is this and how do you know what it is? Hopefully you can appreciate 4 pairs of legs. And essentially, if you can see the organism on yourself or your pet, and you can see 4 pairs of legs, it has to be a tick. This tick is only just attached. It hasn't really started feeding yet, but it's very clear it's a tick. I think one of the obvious questions is it really important to know what the tick is? Well, the answer would be no if there was only one tick. And when I came in 1997, there really was only one tick we occasionally saw on pets and ourselves, which wasn't associated with Lyme disease. There are now two ticks that we commonly find on ourselves or our pets in southern Ontario. And so it's really important to know which tick you're looking at, because only one of the two ticks is associated with the risk of Lyme disease. Let me first, though, just make sure you're aware what ticks you can potentially find if you go online, if you look in textbooks with respect to North America. And this is a little frightening, but it is a list of the 8 ticks you typically can find on your pets or yourself across North America. The column on the left-hand side is the common name for the ticks, and the column on the right-hand side is the scientific name for the ticks. You'll be pleased to know we don't see all 8 of those ticks here in Ontario. As I just said, we really today only see 2. And they're indicated with those blue arrows. The tick that was always in Ontario for at least the last 100 years was the American dog tick, Dermacentor variabilis. The new tick that's very much the emerging issue is the deer tick, or Ixodes scapularis. And it's those 2 ticks I'm going to focus on for the rest of the talk, because one of them is associated with Lyme disease and one is not. Now, one of the questions I often get when I give this talk is, do you think we're going to see other ticks in Ontario in the near future? And the general consensus is yes. There's really 2 others on that list that we think might be the next tick. One of them is called the Lone Star tick, or Amblyomma americanum. And you would think with that name, it should be only living in Texas. And about 50 years ago, that was true. But in the last 50 years, that tick has spread right up the whole of the eastern side of the US. It's now established in New York State and Maine. That could be the next one. And until a few years ago, we thought it definitely would be the next one. But in 2017, a brand new tick for North America got reintroduced from Southeast Asia. It's called the Asian longhorn tick, and it was first detected in New Jersey. And that was in 2017. But in the 7-8 years since then, it's now spread to about 18 US states, all in the central northeastern region of the US. So that might be the other tick that comes into Ontario. But at the moment, we see just 2, the American dog tick and the deer tick. Now, I said it's really important to know which tick you're looking at. These are 2 pictures of the 2 ticks. They're unfed ticks, and the reason I'm using images of unfed ticks is just easier to show you the features for identifying the ticks. When you look at ticks, always look at this structure that's indicated in the blue arrow that's just behind the mouth parts. It's called the scutum or the plate, and it's found on all female ticks that we see. And the question to ask yourself is it all dark brown or is it multicolored? And I think it's pretty clear if you look at the tick on the left, it's multicolored. And if it's multicolored, essentially the tick has to be the American dog tick. The scientific name is Dermacentor variabilis. So that's the tick on the left. Its scutum is what we call multicolored or ornate, multicolored in appearance. If you look at the tick on the right, and you look at the plate, hopefully you can appreciate by comparison, that is all dark brown. It is not multicolored. It's what we call inornate. And as soon as you see that, it really has to be the deer tick. The scientific name is Ixodes scapularis. And it's the tick on the right that's the recent emerging tick in Ontario at the present. And it's the tick on the right that's associated with the risk of Lyme disease caused by a bacteria called Borrelia burgdorferi. So if you see the tick on the left on yourself, yeah, it's pretty gross, but essentially there's no risk, well, there's definitely no risk of Lyme disease, and essentially there's no risk of anything else here in Canada. Few comments about Lyme disease and the bug that causes it. It's a bacterial infection, as I mentioned, and the bacteria is called Borrelia burgdorferi. These are images taken under an electron microscope of the bacteria, and it has a very interesting, unique appearance. The disease it causes is referred to as Lyme disease, and it gets its name from an area of Connecticut called Lyme. All right, so that's why it's called Lyme disease, because the disease was first described in the Lyme area of Connecticut. But it's certainly been in that region for over 100 years. But it's the distribution of the tick that transmits this, and the risk of Lyme disease has changed dramatically, particularly in the last 20, 30 years. Now, the reality is, if you find a tick, particularly on your pet today, it likely has not only attached, but it started feeding. And ticks feed on people or other animals because they need blood. And female ticks need the blood so that they can then produce eggs that are then liberated into the environment. This is the ear, actually, of a dog in Toronto. Came into a vet, and you can see this tick firmly attached to the skin of the dog. It's a female tick. She's ballooned significantly because she's feeding on blood. But what has not changed in appearance is this plate or scutum here. And the question to ask is it multicolored, all right, or is it inornate, just all dark brown? Hopefully, if you look at that, you can appreciate it's multicolored. This is the American dog tick, Dermacentor variabilis. And so if I asked you, is there a risk of Lyme disease from this tick? The answer is no, definitely not. I think one of the questions that often comes is, where are we likely to find these ticks? And so I wanted to first talk about Dermacentor variabilis. But both ticks have a very similar life cycle in many respects. The adult ticks are feeding on animals or people because they need blood. And once the female is fully engorged, she drops off into the environment and she releases eggs. Now, if that happens indoors, essentially nothing will happen because the humidity, temperature are not appropriate for survival of the eggs and what hatches out of those eggs. But if they're released into a grassy bush environment with an appropriate temperature and humidity, particularly at the base of the grass, the larvae that hatch out of those eggs are viable, but they need to feed on blood, and they typically feed on the blood of small rodents. Once they're fully fed, they drop off back into the environment and they molt to what's called a nymph. Again, that only will survive outdoors in the same environment as the larva. That also needs to feed on blood, and they typically feed on other wildlife species. But once they're fully fed, they drop back off into the environment and then they molt to immature adults. But adults, to mature, as I've just showed you, they need to feed on blood, and that tends to be more likely people or dogs or sometimes cats, all right? And once they're engorged, they then drop off into the environment and to lay eggs. So on which species do Dermacentor variabilis larvae feed? As I mentioned, it's small rodents, typically voles and mice. The next stage that they molt into feeds on slightly larger wildlife species, typically rabbits, raccoons, opossums, but occasionally you'll see them on dogs and cats, and they certainly occur occasionally on people. The stage we usually see are the adults just because they're larger, all right? And they also will feed on wildlife species in addition to people, dogs, and cats. What's the most appropriate environment for Dermacentor variabilis? It's typically open grassy meadows inside young forests along trails. And essentially this tick is right across the eastern half of Canada, not everywhere, but in patches right across eastern Canada. And that's certainly true across southern Ontario. We don't see this tick all year round. We primarily see this tick in the early spring to early summer. So we're just going into the season where we see certainly this tick in the environment, ourselves and our pets. Here's another tick removed actually from a dog in Toronto. And my question to you, which tick is it? Is it the tick I've just showed you, or is this the deer tick? Again, look at the scutum or the plate and ask yourself, is it all dark brown or multicolored? And hopefully you can appreciate this one is all dark brown. This tick is obviously also fed significantly. This is the deer tick, Ixodes scapularis. And yes, there's a risk of Lyme disease associated with this tick. These are two pictures of the deer tick that are not fed, all right? And the one on the left, I think you can very clearly see the plate or the scutum on the back and the long mouth parts. The one on the right, all right, is a tick that's crawled all the way to the top of a blade of grass, and you can see the front legs are sticking out. It's called questing, What's the tick doing? It's waiting for you or your pets to walk by. And if you come in contact with the tick then transfers to you or your pet. So these ticks typically don't hunt us, they wait for us to go into their environment. But once we brush up against them, they transfer to us. Now, as I've already mentioned, it's the deer tick, or Ixodes scapularis, that's certainly responsible for transmission of the bacteria that causes Lyme disease, and that's Borrelia burgdorferi. And that occurs both in people and in dogs. It does also, to a lesser extent, transmit another pathogen called Anaplasma phagocytophilum that causes disease, again, both in people and also in dogs. But it's much less common in our ticks than Borrelia burgdorferi, the cause of Lyme disease. Where will that tick occur? Well, you need to understand the life cycle of this particular tick. Why is it called the deer tick? It's called the deer tick because it preferentially feeds on white-tailed deer, right? It feeds on deer to get blood. But once the adult is fully fed, and it's the adult that feeds on white-tailed deer, all right, once the tick is fully fed, it drops off into the environment, just like the other tick. This only has a viable continuation of the life cycle if this occurs outdoors in certain times of bush, and I'll explain that in a second. But just like the other tick, once it's in the environment, it liberates eggs, and out of those eggs hatch larvae. These preferentially feed on wild rodents, but particularly white-footed mice. Why are they feeding? Well, they're feeding to get blood. But the other thing that's highly significant is this is when the tick gets infected with the bacteria that causes Lyme disease. Let me just explain that. The adult female tick, if it's infected, does not pass the infection on to its offspring. So all the eggs that are released into the environment and the larvae that hatch from that are not infected with the bacteria that causes Lyme disease. However, the bacteria commonly occurs in the blood of wild rodents, particularly white-footed mice. It doesn't make them sick, but when a larva feeds on an infected mouse, in addition to ingesting the blood, it ingests the bacteria that then infects the ticks. And once the tick is infected, it remains infected for life. But once that larval stage is fully fed, it drops off into the environment as the other tick, and then it molts to a nymph. That nymph also preferentially feeds also on white-footed mice. So if the larva doesn't get infected, this feeding strategy maximizes the chance of the tick getting infected. Again, if the nymph gets infected whilst it's feeding on blood, it remains infected for life. Once it's fully fed on blood, it drops off into the environment and it molts to the immature adult. And it's the adult stage we typically see on our pets and ourselves. Now, you might think from this life cycle, then, if you're in an area with no white-tailed deer, all right, then there's no risk of Lyme disease, all right? And the answer to that is that's not true. There's certainly a park in New York City where there are no white-tailed deer, but there is the tick and there's a risk of Lyme disease. And in that environment, the adults they can't feed on white-tailed deer because there are none, but they've learned to feed on rats. The risk of Lyme disease is nothing like it is in areas where the deer occur, but you don't have to have the deer in the environment for the tick to live successfully. It just prefers feeding on deer. Just to give you some idea of size, and therefore whether or not you're likely to see these different life cycle stages of the deer tick, the arrow here shows you an image of a larva relative to the thumb of a person. And if I asked you, do you think you would see this? I think the answer is no. The reality is we almost never would see it because it typically only feeds on wild rodents. The next arrow shows the size of a nymph. And I think it's important to appreciate, we think about 50% of all the Lyme disease cases in people are actually associated with the feeding of nymphs and not adult ticks. Would you see these? They do preferentially feed on wildlife species, but they do certainly feed on people. They're not big, all right? They could easily be missed if you're not looking carefully. I think the ticks we most commonly see are the adult ticks because they are larger. Right, and certainly once they're attached and they're feeding, they get significantly larger. Let me just remind you then, on which wildlife species do you see each of these stages of the deer tick or Ixodes scapularis? As I mentioned, the larvae particularly feed on white-footed mice and other small rodents. The same is true for the nymphal stage. But something else that's really important to appreciate about these two stages, they also feed commonly on ground-dwelling birds. And the significance of that is they attach to the birds to feed on blood. They remain attached for a good few days whilst they're feeding. But if the bird takes off whilst the tick is feeding, the tick literally goes on a free flight. And in the spring, that's one of the primary drivers for the introduction of this tick into our region of Canada from the northeastern region of the US. So bird migration, particularly in the spring, is a big driver every year for movement of these ticks across North America, particularly from the northeastern US into southeastern parts of Canada. As far as adult ticks, I mentioned they prefer to feed on wild white-tailed deer, in addition to a few other wildlife species, and it's usually those that we're most likely to see because of their size. This tick does best in vegetation associated with deciduous forests. So it's typically in that environment you're most likely to come in contact with ticks. You will find them elsewhere, but they typically do best in that environment. Let me show you a typical deciduous forest. There's 4 images here. You can see the top right shows you a tick that's walked up a blade of grass. Why? It's waiting for you or I to walk past. In the image at the bottom left-hand of these 4 images, had a question for you. Which part of that image will you not come in contact with this tick? And then the answer to that is if you walk right along the middle of this trail here. But as soon as you walk off into the vegetation, you put yourself potentially at risk of coming in contact with that tick. So where you walk in the environment can very much change the risk of exposure. I think one thing to appreciate, we don't come into contact with this tick all year round. This shows you the number of ticks that were submitted to Public Health Ontario in 2018, the number of deer ticks. And the green bars indicate the number of adult deer ticks they received each month. And it goes from January on the left through to December on the right. We're just at the beginning of March. It's cold at the moment, and you wouldn't expect to see the ticks until the temperature goes above about 0 degrees centigrade. But typically, over the next 2-3 months, the numbers in the environment increase significantly. And this year, there was a peak in May, and then the numbers dropped off June and July. But then they reappeared again in the fall, typically September, October, November, into early December. Typically, the adult ticks first appear in the fall, and if they don't feed at that point, they survive the winter under the snow. And so the ticks we see over the next 2 or 3 months are all ticks that have survived the winter under the snow. So there's certainly a risk of Lyme disease in those in the fall and the spring, but the reality is in the summer months, the nymphs are primarily in the environment. And so there's typically at least a 9-month period from March to November, December every year, where there is a particular risk of exposure to these ticks. So what influences the risk of exposure? Number one, remember, ticks don't come looking for you or me. You or I have to go into their environment. So it depends on where have they established and are we going into their environment. So where are they in Canada at the moment? I think the important things to appreciate is prior to 1997, the only place in all of Canada where the deer tick or Ixodes scapularis occurred is where it's shown with this red arrow, and that's Long Point on Lake Erie. It was in the years following that, so this is just after I arrived in Canada, that people started finding the deer tick elsewhere, and the Public Health Agency of Canada then did routine monitoring everywhere across Canada. And people were sending in the ticks for identification. And this shows you all their data for 2008. Every red dot is where a deer tick was submitted. And if you look first on the West Coast and go east, nothing from British Columbia, but you can see 3 submissions from Alberta, 1 in Saskatchewan, and then things changed dramatically. Throughout most of southern Manitoba, throughout particularly southern Ontario, southern Quebec, and throughout the maritime provinces. Now, the important thing to ask yourself is when you find a tick on yourself is to ask you two questions. Is this an adventitious tick, which means a tick that's recently fallen off a bird, or is it part of a population of ticks that have established and are actively breeding? The reason for asking that question is because if it's an adventitious tick, so it's a first time a tick has been found in an area, all right, the chance of Lyme disease and the chance of establishment in that area are low, all right? But if it's an area where the tick has been well established, it's an endemic population, typically the risk of Lyme disease is much higher. So the longer it's in the environment, the longer the ticks are in a certain environment, the more likely they are to be infected. Let me just explain that then. For instance, if you go out to Alberta, the 3 ticks that were found there, there's no evidence to the present day that there's any risk of Lyme disease in Alberta. There's no risk of Ixodes scapularis. At least that was true until a few years ago. But at this point in 2008, there was no evidence that the tick had established there. Any ticks that were found had recently fallen off migrating birds. So where are the risk areas or the endemic areas, particularly where we are in southern Ontario? This is one of the estimated Lyme disease risk area maps put out every year by Public Health Ontario, and you can find these maps published every year. All right, this is the map for 2017, and the yellow on these maps is where they have documented establishment of Ixodes scapularis or the deer tick. They do that because if you or I submit a tick from a new area, they go out into that area, the public health folks do. They literally drag cloth across the bush to look for the ticks. And if they find it this year and next year, they make the conclusion it's an established tick population. Just to remind you, up until 1997, the only place where this tick occurred in Canada was Long Point in Lake Erie. And you can see by 2017, there's substantive establishment right throughout Eastern Ontario, but also right throughout most of the southern GTA area, as well as the Niagara Falls area, all right, the Rondo Provincial Park and Point Pelee Provincial Park. The establishment on the northern shores of Lake Erie and Lake Ontario, first in the provincial parks, is exactly what you'd expect in association with birds migrating up into Canada every spring from the northeastern US, because it's typically that's where they'll land. The birds will land to refuel, so to speak, before they take off and migrate further north. So that's 2017. Let me take you through to 2024. Look at the yellow areas, 2017. I put a circle around the area particularly to look at because this is where you and I are located. This is 2021, just 4 years later. Let me go to 2017. 4 years later, look at the GTA area. You can see there's been substantive movement of the risk area northeast, but also right round the entire western end of Lake Ontario. That's 2021. Let me take you through to 2024. It's incredible how quickly the risk of establishment of this tick is changing. Let me go back to 2017, 7 years later, just 7 years later, 2024, that's the current risk area. Every physician, every veterinarian in Ontario should have this map, because if you go in and there's any discussion about Lyme disease, the first question is, do you live or do you travel into any of these risk areas? So if you ever have concerns that you might have early Lyme disease, take this map with you. You can download it from Public Health Ontario. The 2025 updated map usually comes out May, early June time. Why are things changing? Well, one of the things that's been changing and driving this is a lot of what's been happening in the northeastern US. This map indicates the number of human cases of Lyme disease reported in 2001. Every blue dot indicates a human case of Lyme disease. And you can see the vast majority of all the human cases are in the northeastern US, Connecticut, New Jersey, New Hampshire. And it's thought about 80% of all the human cases of Lyme disease in the US occur in that region. The other lesser hotspot is just to the west of the Great Lakes in the US. That's 2001. Let me take you through to 2019. That's 2019. Let me go back to 2001, 2019, there's been, excuse me, a substantive increase in the risk of Lyme disease in both of those risk areas. Has some of that changed because of greater monitoring? Almost certainly yes, but that doesn't explain the rapid change. And what's significant to us at this time of the year, it's the northeastern region of the US where birds migrate every spring up into Canada. Now, I know if I was with you, you would say, but birds have always migrated up into Canada. And that's true. But what has changed is the number of ticks that are attaching to birds and coming up. So the numbers of ticks coming up every spring have been increasing, and to an extent now where it's greatly increased the ticks of establishing here in Canada. So why is the distribution of the deer tick changing? Certainly by bird migration is one of the drivers in association with an increase in tick numbers in the northeastern US. Changes in the deer population, often in association with reforestation, are helping the establishment of that tick in some areas. But probably the biggest driver for the change in distribution is climate change. Let me just show what the predictions have been from the Public Health Agency of Canada, predictions that were published a few years ago on perfect environmental suitability. And environmental suitability is not only the bush and vegetation, but in these maps, it's the temperature and humidity that will support the tick. And in these maps, look at the red color because that indicates ideal temperature and humidity, just temperature and humidity. And you can see in the year 2000, there's almost no red on this map. The only areas you can see are the Niagara area, the eastern region of southern Ontario, and southern Quebec. But that's 25 years ago. Let me take you through to the predictions for 2020. Look at the red area. You can see now it's throughout almost all of southern Ontario and southern Quebec. And the predictions, certainly for the eastern half of southern Ontario, are almost exactly what we're seeing. We're not seeing the same change in the southwestern region of the province because the vegetation is not supportive in many areas for the tick. The temperature and the humidity is, but not the vegetation. Let me take you through into the future. 2050, this is what the predicted perfect environmental suitability will be for this tick, and going through to 2080, that's what it'll be. All the predictions are that the climate will change greatest in the central parts of North America. It doesn't mean you'll see the tick over the entire red area because you also need ideal vegetation, but we will start seeing the ticks throughout most of this area. And certainly up to the year 2020, the predictions have been pretty accurate for where you will and where you won't typically find the tick. So to what extent is the risk of Lyme disease increasing in any given area? I've showed you the geographic distribution of the tick is changing, but what also is changing is the proportion of the ticks that are infected with the bug that causes Lyme disease. Just to drive this home, these are data from the Public Health Agency of Canada on the proportion of the ticks they detected infected with the bug that causes Lyme disease. And back in the year 2007, they only found that about 7.5% of all the ticks that were examined were infected with the bug that causes Lyme disease. But just 6 years later, by 2013, almost 20% of the ticks they were examining were infected with the bug that causes Lyme disease. And as a rule of thumb, if the tick is recently established in an area within the last few years, typically no more than 5 to 7, 8% of the ticks are infected. But the longer the tick is in that area, the more likely it is to get infected. So overall, back in 2013, the proportion of ticks that were examined that were infected was 18.4%. But let's look at some areas where the tick has been established for significant times. The tick has been in Kingston, well, in 2019, it had been in Kingston for at least 10 years. And at that point, about a third of all the ticks were infected. If you go to Murphy's Point Provincial Park, which is roughly halfway between Kingston and Ottawa, there's a park there where in 2014, just under 80% of all the ticks are infected. Everything seems to be perfect in the eastern parts of Ontario for this tick. So almost all the ticks there are infected. What about the place in Canada that's had the tick the longest? Long Point, Lake Erie. And these are data from 2009. About 2/3 of the ticks are infected. So there's a point at which it typically doesn't go any higher, and Long Point, it appears to have established at about 60%. But that still means if you pull 2 ticks off yourself visiting Long Point, it's likely one of them infected. Is the risk of infection in people in Ontario changing? What evidence is there for that? I think it's first important just to tell you a little bit about Lyme disease in people. Well, the tick needs to feed, and what happens in people is actually very different than what happens in dogs. If the tick is infected, it transmits the bacteria that causes Lyme disease, and then within a week or 2, typically 7 to 14 days later, people develop this very large skin rash that's typically more than 5 centimeters in diameter. All right, that's the initial indication of infection that occurs in most, but not all people. So this is much longer to develop than, for instance, a typical mosquito bite, where typically myself develops a lesion really quickly within a few hours. This develops 7 to 14 days later. At this point, the bacteria in the skin, but then they start spreading around the body. And this is why over the following month, people often will develop flu-like signs. It's very easy to treat at this point, but if the infection spreads around the body, it can cause very significant disease. But if you catch infections in the early stage of infections, it's very easy typically to treat. For the last 10 years, at least, this infection has been reportable in Ontario. Physicians have to report it. And these are data from Public Health Ontario, the number of human cases reported every year, going back actually to about 2013. And not surprisingly, the number of human cases every year, going forward to 2022, has been increasing significantly. What's particularly interesting is when in the year most cases are diagnosed. And this shows you the data for 2017. The green bar graphs indicate for each month the number of human cases diagnosed. And you can see the peak is midsummer in July. Most people go to their physician with Lyme disease in the very early stages of infection, as I've just described, and that means infection acquired in the previous month. So most people get infected with the bug that causes Lyme disease during the late spring, summer months. So I want to finish by asking some questions about, will you get Lyme disease? If I showed you this picture and ask you, will you get Lyme disease if you pull this off yourself? The first question is it the right tick? Well, look at the scutum or the plate, and I think you can appreciate it's all dark brown. This certainly is the deer tick, the tick that causes Lyme disease. Something that's really important to appreciate, the tick needs to attach to you or your pet for at least 36 hours before it can transmit the bug that causes Lyme disease. So if you check yourself daily for ticks, that can have a dramatic impact on the risk of Lyme disease. You can eliminate the risk if you're checking yourself daily for ticks. One other thing just to appreciate, not every tick is infected. If it's a new area, it's very likely the tick won't be infected. But either way, if you check yourself daily for ticks, you eliminate the tick risk. What can you do to prevent the risk of Lyme disease in dogs? Number one, go to your veterinarian and ask for a good tick product. And today there are a lot of really good tick products. We unfortunately don't have them for people. What you should also discuss with your vet is whether or not the Lyme vaccine for your dog is appropriate. At the moment, there are a number of Lyme vaccines for dogs. There aren't for people. That may well be changing in the near future, but it may be appropriate for your dog. And every day, when you come back from a walk, check your dog daily for ticks. As far as people, well, if you look in the textbooks, it says basically don't walk in the woods, avoid bushy and grassy areas. Which I realize you're going to say, are you serious? We have to start learning to live with these ticks. And if you want some perspective, go to Connecticut during tick season, where people have learned to live with this tick a lot longer than us. Ideally, the recommendation certainly is wear long pants tucked into your socks when you're out in the bush, because that means that when the ticks transfer to you, and that's usually below the knee, they attach first to your clothes rather than your skin, and then they'll start walking upwards to try and find skin. And you're more likely to find them on yourself, particularly if you're wearing lighted colored pants. You can apply various compounds to your skin or your clothes that reduces the risk of the tick transferring to you. And certainly for our skin, there are many DEET products. As far as our clothes concern, there is a compound called permethrin that can be impregnated into clothes, and I gather you can still get these from Marks. They very much stop transfer, but be careful if you have a cat in your household. This is highly toxic for cats, so I wouldn't do it if you have a cat in your house. And just like dogs, check yourself every day for the presence of ticks, every 24 hours. And the primary site you're most likely to find them is around the back of the head, in the armpits and the groin. So I'm going to end up with a final exam. Will I get Lyme disease from this tick that's been pulled off myself? Hopefully you appreciate the answer is no. This is Dermacentor variabilis, the American dog tick. What about this tick? Is there a risk of Lyme disease? I think if you look carefully, you can appreciate the scutum's all dark brown. This is Ixodes scapularis, the deer tick, but it is not fed. Remember, there's no risk of Lyme disease from this tick if it's not fed for at least 36, 48 hours. Finally, what about this tick? Is there a risk of Lyme disease? Well, it's the right tick. The scutum is all dark brown, and it's fed significantly. Like, I don't think I've seen a happier fed tick. All right. Is there definitely a risk of Lyme disease? No, but the longer you've had ticks in this area, the more likely that tick is to be infected. If you have any concerns, take the tick to your physician with the map I mentioned. Hopefully you've got some appreciation that the risk of Lyme disease is very much an emerging issue across much of southern Ontario, particularly along in the national parks on the northern shores of Lake Erie, Ontario, but also right throughout the GTA area. If you go into any park area today, you will find this tick, and there certainly is a risk of Lyme disease. Certainly right throughout the GTA area. The risk of exposure and Lyme disease very much depends on your lifestyle. We've got to start learning to live with this tick and not let it ruin our life cycle. And talk to your vet about anything that would be appropriate for tick prevention and reducing the risk of Lyme disease in your pets. And most importantly, check you and your pet daily for ticks during tick season if you're out in the bush. Just like to thank these various people that contributed to the material I presented, and I hope that was helpful and informative. Philip, thanks very much.
Andrew, thanks very much. That was really a great presentation, very comprehensive, covering everything from where the ticks come from to how they get transmitted to the effects if we actually come into contact with them. But why don't I start with some questions? I have one, maybe two questions, and then Ellen's going to take a look at who has posed questions in the chat or is raising their hand. The first question I have, Andrew, is how serious can Lyme disease get? I mean, I've read it can be seriously debilitating for some people. Obviously, if it's caught with an antibacterial medicine in time, it seems to be okay. But if that doesn't happen, what are kind of some of the long-term effects of Lyme disease on our body?
So you're talking about people, Philip?
Yes, people.
Yeah, sorry.
Sorry.
No, it's okay because the situation is very different in dogs, and I'll come to that in a second. Now, I should just point out, I'm not a human physician. I'm not really supposed to talk about this, but I will, because you have to. Philip, you're right. In the early stages of infection, when you get those skin lesions, when you have flu-like signs, the infection is typically very responsive to antibiotics. But it can, in some people, if it's not treated at that point, the bacteria can spread around the body and cause significant nasty disease, potentially life-threatening, in a long-term chronic form because of infection elsewhere. It doesn't happen in a lot of people, but it certainly does happen, Philip. And so it can be a very nasty disease in people. It's very different. Well, it's very different, for instance, if you have a cat. Cats, if they go outside, if they get infected by a tick, they never become sick. Cats are really resistant to infection. People are not, all right? Most people that get infected do become sick, whether it's the skin form or the later form I've just mentioned. Dogs are somewhere in between. We think only 5 to 10% of dogs that get infected ever become sick. It's usually, in dogs, easy to treat. They can become significantly lame, but that responds to treatment. The nasty forms of disease that I've just mentioned typically only happen in people.
Okay, thank you. Thank you very much. Ellen, do you want to take over and see if there are some other questions from our audience that we could pose?
Certainly, the first question related to the role of Public Health Ontario and where they get their tick samples from. How are they submitted? Are they from physicians, or how do they get them?
So it's changing over time, but what I would encourage you is if you find a tick on yourself, take it to your public health unit. All right. Now, I should just point out their funding isn't substantive. All right. If this is the first time that tick has been found in that public health area, they typically will be really interested. All right. Because what then will happen is they'll send people out to look for the ticks to see whether or not it's established. So if you're in an area that's not had this tick before, they're usually very receptive to you giving them ticks and finding out where they came from. But for instance, if you go to Eastern Ontario now, public health people are typically not that interested because the argument is we've had it for a long time. We know it's here. We have limited amount of money and it needs to be spent on what's relevant to us today. All right. But I certainly would also, if you don't go to your public health unit, go to your physician with it as well, if that's a concern, and physicians will submit it for you, particularly if it's a new area. Ellen, does that help?
Certainly that helps, yes. And I mean, there certainly has been a thank you to you from a member of the audience that these are great tips. And then the next question relates to dogs, and do they get the bullseye symptoms from Lyme disease as well?
No, I mean, the answer is no, you very rarely see it. I mean, someone's going to come back and say, would you see it? Because most dogs often have dark skin. Do you know what I mean? There's not a lot of, well, many dogs don't have white skin. But the general feeling is dogs don't typically get the skin lesions. What dogs typically develop is lameness. And usually they go lame in the leg nearest to the tick bite site. But it's an intermittent lameness. So you can have a dog that's lame for a few days, then it looks fine. A few days later, it's lame on another leg, and then it improves. So it's a subtle shifting intermittent lameness. And if you ever see that in your dog, take your dog to the vet, because at that stage, it's pretty easy to treat. Ellen, all right? Very rarely, Lyme disease can cause a nasty kidney infection in dogs that can be life-threatening. Very different typically from people. There's other nasty forms that occur in people, though, Ellen.
Thank you. So here's a question that I think resonates with any gardener, and I guess these are Toronto gardeners, from Sonia. Would my back garden be a dangerous place to walk? I have no long grass, but walking through plants, could something like raspberry bushes have ticks?
That's a very good question. It very much depends on what your garden backs onto vegetation-wise, all right? Because typically what you've just described, raspberry bushes by themselves typically don't constitute an ideal environment for the ticks. But if the other side of the raspberry bushes is, the edge of a deciduous forest, you might have significant ticks there, and every now and again, one might wander onto your raspberry bushes. So it really depends on what the vegetation is nearby, Ellen. Can I just follow up on one topical issue, and that is there are a number of companies that are offering spraying gardens with insecticides to control ticks. All right, so companies will do that. All right, all I would say is, do they work against the ticks? Yes. They typically are not long lasting. And the bigger concern for many of us is if they kill ticks, the compounds kill many other insects, for instance, bees as well. And so there's a big concern about using compounds, drugs, to control ticks in the environment, rather than, for instance, keeping the bush grass short, making the environment vegetation-wise unsuitable for ticks. Because typically a grass lawn is not a risk area for this tick, the deer tick.
Excellent. Thank you. Here's a question. Do only female ticks bite us and our pets?
So the answer is no, both will feed. However, it's thought the risk of Lyme disease is only associated with female ticks because they feed long enough for the bacteria to move from their gut to their mouth parts. Male ticks don't feed nearly as long. So it's thought there's really no risk from male ticks, which is great because they're a lot smaller. So it's the bigger ticks that are more likely to be the concern.
Yeah. I'm wondering, what are some of the most common misconceptions about ticks and Lyme disease that you come across? The thing that we, I guess that may be changing so rapidly too, right? As the
So I'm speaking from a veterinarian's perspective, Ellen. I think one of the misconceptions, certainly in the veterinary area, is that all dogs that get exposed need to be treated. But the reality is 90% of dogs that do get infected never become sick. And so everyone's trying to be cautious with the antibiotic that's used to treat cases of Lyme disease, like only treat people and only treat animals if they need it. Do you know what I mean? Yes, if you've got a skin lesion, but if there's nothing else, if it's just a tick you've pulled off, the usual recommendation is ideally don't treat unless you're really concerned. Right? Now, in humans, unlike dogs, if you go to a physician and tell them, here's a tick that's fully attached to me, fully engorged, there is a protocol, which actually you can also get from the pharmacy, which I think is a single dose of doxycycline. And that's enough to get rid of the infection in its early stages. It's only a one dose. The treatment in dogs is 28 days of the same dose for Lyme disease. And we're trying to be careful we don't overuse these antibiotics, because the last thing we want is drug resistance in the bacteria that causes Lyme disease.
Right. Yes, that and you've been studying that idea of drug resistance, antibiotic resistance in these.
Yeah, we've not seen it yet, but we've certainly seen resistance to the same antibiotic in other bacteria.
Yeah. So here's a question from Alex. I believe you explained that there are vaccines available for dogs, but not yet for humans. If so, would it have been easier to have vaccines for dogs and harder, or why? Why would it have been easier to have vaccines for dogs and harder for humans so far?
So, Ellen, this is actually the most exciting question in my mind, because there's very interesting developments currently occurring in Eastern Ontario. Until about 10, 15 years ago, there was a human vaccine for Lyme disease. It was discontinued because it seemed to cause more problems than benefits. Then the vaccines were developed for dogs that were not associated with problems. And then what's really encouraging, basically one of the same companies that developed a Lyme vaccine for dogs is currently carrying out a large field trial in people in Eastern Ontario. It's a company you'll have heard of, based in Quebec. So a lot of this is very much a Canadian solution to the problem. I've met a number of people who are on the trial, and if we were talking in Eastern Ontario, it's very likely you'd have people on this call that are involved in that trial. So keep your fingers crossed, folks, because if we get a vaccine for Lyme disease in people, it could change this whole area dramatically. Like the fear, I think, that some people have with Lyme disease would largely be addressed. So we'll know in the next, I think, 2 to 3 years, my understanding is. But it's undergoing field trials, which means the vaccine has met the initial safety concerns that are always carried out before you do a large field study. So fingers crossed.
That's wonderfully encouraging news to wait 2 to 3 years yes, sign me up. Somebody asks, Valor trial ? And maybe is that the name of the company, perhaps?
So, no, it's not the name of the company. I don't know whether I don't know, to be honest.
Okay.
Maybe I don't know what that is. Sorry, I haven't heard the word before.
Yeah.
Sorry.
Okay, and is the antibiotic available from pharmacies without a prescription for humans?
So my understanding is yes, because I think the province realized you don't need to be taking up the time of your physician. Do you know what I mean? As far as a single dose of doxycycline because you recently pulled a tick off yourself. So my understanding is yes, if you go to a pharmacy as well. I think it would help if you take the tick with you as well, just as proof.
Yes, yes. Okay, that seems to be the essence of the questions here. Uh, you know, this is going to be a much watched recording, and I'm so grateful for your time.
You're
Yeah.
welcome.
Yes.
If anyone has any questions, please feel free to drop me a line. You've got my email, so I'm sure, and you can pass it on, and you'll find it on the first slide, I think.
Yeah.
That's great. Yeah. Andrew, thank you so much. That was really excellent. And for those of us who like to go hiking, particularly in the spring, I gather that May is really, May and June are the months we have to be really careful about, because those are the ticks that have come out of the winter. And
Well, just to give you some perspective, like we have a family dog, and I've always started tick prevention on April the 1st, and we go for a long off-leash walk in a risk area every Sunday. Last year, we first found the ticks on her on March the 15th.
wow.
So wait and see. Like it's awful outside today for ticks, but that can change quickly.
In 1 month, yeah. Okay, so your talk is very timely for our membership, and our membership is very active outside, as you can tell from our walks and so forth. So again, thank you very much, and good luck with all your continuing research. And this has been a great presentation.
Thanks for that.
And thank you, everyone, for coming. And so watch your ticks, and tuck your trousers into your socks, or take rubber bands or something and really secure the bottom of your trousers. That's what I usually do. Okay. Thanks so much.
Okay. Thank you. Bye-bye.